Good afternoon, everybody. My name is Russ Reed. I'm the Executive Director of the National Center for the Biotechnology Workforce, and I'm also the Project Director for the Consortium for Bioscience Credentials, which is a large DOL TAC grant that we have in place here at Foresight Tech. I want to welcome everybody. I want to say especially welcome to students and to our guests and also to our management here at Foresight Tech. This is SciTech. This is a speaker series that is for science and technology learning. We started it a few years ago here at Foresight Tech. We've actually had over 1,600 people come to the lectures. We've had a variety of lectures, everything from intellectual property to science to environmental science in Liberia to biofuels. And really, this is a series for you. And so as students or faculty, if you have interests in particular aspects of the biosciences, we would like you to approach us. Approach the card that you have in your folder. She's omnipresent person here on campus. Her name is Micah Welsh. Please, if you have suggestions or ideas, we love to hear from you. We're really aiming to do high-quality people, and today we're very fortunate in having an extremely high-profile person in the North Carolina biosciences community, Dr. Christy Shaffer from Hatteras Venture Capital. And I'm going to introduce her in a second. Just want to remind those that we can't do this without the support of the college and also the North Carolina Biotech Center, as well as various sponsors that come and help us from time to time. I want to particularly thank my team for the National Center for all the hard work they do to put this together, Mona Kofer and Michael Welsh and Jessica Tyler and Mary Flanoy. At the same time, I want to thank Brooks Foster, from BioNetwork. Brooks has been really, really supportive in making sure the communications are right for this program. And so without further ado, I'm going to have that opportunity to introduce briefly Christy. Her profile is in your folder, so you should all have a folder, be able to review that profile. But her topic today is my journey as an entrepreneurial scientist, CEO, and investor. That's a pretty large sentence. There are three major concepts in there. And so I just want to make you aware of that. But there's some bullets here which I think are extremely important that I want to just review with you a little bit because it's personal. And that is to say that Christy and I both worked at the Burroughs Wellcome Company. We worked in different groups, and we probably weren't aware of each other when we were working because I worked in one country and she worked in the other country. But the point is, we probably ended up supporting the same projects at one time or another. And so we kind of have a history together. We also have a history together because we were both CEOs of companies. She took a company upwards to 250 people and was able to have that company sold off to Merck Pharmaceuticals. Is a great achievement, unbelievable achievement for an entrepreneur and a scientist to start. So she has been in the industry for about 20 years. She was responsible for raising $300 million in capital for Inspire Pharmaceuticals, took the company public. She grew the company from 20 scientists to 250 employees with revenues of nearly over $100 million. It's always one thing to raise money and to be a CEO, but it's another thing to be a compassionate person, and her list is basically endless. But to give an example, best workplace for scientists by Scientist Magazine, best place to work in North Carolina. Wow. So she retired from Inspire, March 2010. The company was acquired by Merck, as I mentioned. But then she wasn't out of business for very long. Hatteras Venture Capital picked her up very quickly and made her a managing partner. She actually manages the fund. She serves as a board chair of two Hatteras portfolio companies, G1 Therapeutics and Clearside Biomedical. By training, she is a receptor pharmacologist. For all of you who are in here who are thinking of going down that path, and for those of you who might be going through any three of those paths in your thinking as an entrepreneur or as a scientist, stay and talk to Christy today. Ask her questions. This is a very didactic way of doing things here at Foresight Tech. It's a learning experience. So if you're sitting there and you're going to be shy and you're not going to ask the question, you're not doing yourself a favor, because this person is obviously a highly accomplished person, but at the same time has a heart of gold and has actually done so much for science promotion in North Carolina. Her list is endless on that. Let me give you a few points. Of course, she supported the industry by being involved with boards, Innovation Circle chancellors for UNC Chapel Hill, has served on numerous boards, the Council for Entrepreneurial Development. We saw her 3 weeks ago, Scott Sewell, Nancy Johnson, and myself, all over the CED Life Sciences Conference, making sure things were running well, making sure that the right people in North Carolina were recognized for their achievements. She's served on the NC Biotechnology Center, the Biotechnology Institute, Bio, Pharma, and Cliniplace worldwide. She received the Breath of Life Award from the Cystic Fibrosis Foundation in 2009, and I know she's passionate about that organization. There is a penultimate award that people receive in North Carolina in life sciences, and it's given every year at the CED Life Science Conference. It's called the Hamner Leadership Award, after a very famous person, Charles Hamner, who was the first president of the North Carolina Biotech Center. Christy received this award in 2011. We were there to see her receive that award. It was very special. And she sits on nonprofit boards, and I'm coming to the end of my introduction. North Carolina School of Science and Mathematics, Foundation Board, Chair. Moorhead Planetarium and Science Center, Chair. Sid Martin Biotech Incubator, associated with the University of Florida. Member of the steering committee for the NC Statewide Science Festival. Member of the Chairman's Circle for the Nourish International, a top social entrepreneurial organization started at Chapel Hill at UNC. This is one very dynamic and busy person. And on the personal side, I know she has children, grown children, and her husband also is, well, a scientist. Have I got that right, Christy? Okay. So I kind of know where she got her training, university-wise and so forth, and she'll probably speak to you about that. But those of us that worked at the Burroughs Wellcome Company really learned something very, very special. And I think it's what some people call soft skills here. And we hear a lot about it for our graduates, making sure that they know how to work in teams, that they aspire to leadership, that they communicate well. And I think, Christy, if I could say, us that were with Burroughs Wellcome at that time, and we've heard this from Morris Clark, who came and talked to us, who was also a scientist at Burroughs Wellcome that I know Christy knows. When you hear that and you've heard that person has really been brought up through the unicorn management training system, we aspire to those values. So without further ado, would you please welcome Christy Schaefer.
Thank you. Well, good afternoon. Can you hear me? Well, hi, Monica. Hi. Speaking of the person who led CED for 20 years. Well, Russ has really done a great job here at Foresight and recruiting me for this presentation. As some of you know, we tried to do this in December, and there was either an ice storm or snowstorm, and so this is a much better day for weather here. I want to thank Russ for inviting me, and it's great to be here because I've never had the opportunity to be on your campus, and I got to meet a number of students here today, so that's exciting. Before I get started, I'd really like to ask, whoa, did you catch that? How many of you are students? Raise your hand if you're students. Wow, okay, a large number of students. All right, how many of you are focused in the area of science? A very large number, okay. And how many of you are faculty? Okay, great, great. Terrific. And let me ask you this. How many of you in the room would like to be an entrepreneur or are an entrepreneur? Raise your hand. Okay. All right, good. Now, for those who are entrepreneurs, when they see the roller coaster, they know what I'm talking about, right? So my journey, like many entrepreneurs, is very much a roller coaster ride. And when you think of roller coasters, you think of a lot of different things, right? I mean, you think of thrilling, exhilarating, frightening, you're white-knuckled, you don't know if you're going to survive it. All of those things will happen if you work in the biotech space, because one day you're up, one day you're down, lots of things will happen. And many things are out of your control because it can be impacted by the economy or what's happening at the FDA, many other things. But for those people who love science and are entrepreneurs, it's all about the passion that they have. And Russ alluded to this. So one of the reasons I do this is because I believe in the power of passion and science coming together to help patients. And so when I was at Burroughs Wellcome, I had the opportunity to work on a life-saving medication, actually more than one. And I really got hooked on that because when I started realizing that I could personally have an impact on improving patients' lives and saving lives, that was really exciting. So this is my journey, and I want to encourage you to stop me at any point and ask questions. And if you don't ask me questions, I'm going to ask you questions, because I think it's much more interesting to hear these kinds of talks if you ask for a clarification or you think of something that maybe you can add to the conversation. So my journey is probably not different from many in terms of being an entrepreneur, but there were lots of lessons along the way, and I hope that some of them will be meaningful to you. So at the core, though, for me, I think someone's trying to get in. Is that locked? There we go. At the core for me is science, and so I always was very interested in science from the time I was very young. And what got me really excited when I realized that by studying science and doing science, I could have a real impact in the lives of people. And so it wasn't just science for science's sake, but actually making something happen. So that was at the core of everything that I've ever done, whether that be work in academia to Burroughs Wellcome to Inspire to being in venture capital. It was all about science at the very beginning. So the first thing I want to talk about is sort of my scientific background. So I have a PhD in pharmacology. Does everybody know what pharmacology is? I once had somebody ask me if pharmacology was a study of farm animals. It's definitely not that. And so I was really excited to be studying pharmacology in the 1980s when receptor pharmacology was in its heyday, and lots of new receptors were being discovered and new receptor subtypes, which meant drugs could be more selective and treat patients better and have fewer side effects, and have been able to watch that whole history of receptor pharmacology, where over half the drugs now or medicines sold on the market are based on stimulating or blocking a receptor, which is a protein in the membrane. I had the opportunity to do 2 different postdoc fellowships, and I'll talk a little bit about at least one of those. But I think for me and my husband, who are both scientists, and he was 5 years older than me, so it started with him making the most money, and then it ended with me making the most money, and he was never so happy when that day came. But it was really a pivotal move that we made in 1987 to North Carolina. Things were really beginning to flourish here. That's when the North Carolina Biotechnology Center was starting to become much more well-known. The Council for Entrepreneurial Development, which Monica led, was getting off the ground, and there were all these great, academic institutions. And we moved here in 1987 because my husband got a job offer from a company that was pretty small, had come from the UK, had made a baby formula, and that company's called Glaxo. And at the time, there were about 200 people in R&D in the RTP office, and we thought North Carolina would be a great place to live and work. I had no children, but I was about 8 months pregnant when we moved to North Carolina. And so we thought it'd be a great place to have a family, and that's why we've never left. So it was a great place to come from Chicago, much nicer weather. And then I'm going to talk about my move to the biotech industry. But one of the themes that you're going to hear through this presentation is the power of relationships. And you're going to see that there were a lot of people that helped me along the way, and there are a lot of people that I have helped as well, because I wanted to give back because so many people helped me. And that these string of relationships come back around. So somebody that you knew 20 years ago will all of a sudden pop back up in your life and help you get a job that you never expected you would have. So I'm going to stop for a minute. I'm going to ask you this question. If you think for a minute, think of one person who's had a big impact in your life. Just right in the top of your head. Can you picture that person? Everybody got a person in mind that had a huge impact? It can be a parent. It can be a professor. It can be a third grade teacher. Now, I want to ask you a question. Why were they a big impact? Think of a couple of words that would describe that person. First of all, were they boring? Okay, so throw out some words. What are some words that describe your special person? Encouraging. Great, that's a good one. What? Persistent. What? Passionate. Honest. Good. Demanding. Great. Determined. What else? Forgiving. Understanding. Okay, great. Who said demanding? Is that you? Okay. So I'll tell 2 stories on that. When I was doing my thesis work, I had a really tough thesis advisor. First of all, the women in the room will appreciate this. He didn't want to take me as a student because he'd never had a female graduate student, and he didn't want one because he thought we went to the bathroom too much. Okay. So things have changed, ladies. Okay. And so, I wanted to prove myself to him, and ultimately I did. But when we made slides, most of you don't know what I'm talking about, but some of you will remember, there was no such thing as PowerPoint, okay? And you had to make slides in a dark room. It took a long time to make slides. And I'd be so proud, and I'd come and show him my first set, and he would tell me the 20 things wrong with it. I'd have to go back in the dark room and create another set of slides. And then it'd get down to 10 and 5 and 3. Anyway, many, many times he would make me do this. And when someone gives me something today to look at, I always have comments. And I said, well, I learned to do things really well, but that was really good. So my daughter, when she was in high school, she had an opportunity to take Japanese. And they had a UNC professor come over to Carolina Friends School and teach Japanese to these 3 students. And on their first exam, they missed 3 questions. Each missed 2 or 3 questions. They got an F. So she came home really unhappy with this teacher, right? How many faculty are here again? Does it sound familiar? There were 25 questions and we missed 3, and that's an F. And so my daughter's, well, I don't want to, maybe I don't want to take this course. I said, listen, that is the best teacher you'll ever have. And I said, first of all, if you are in Japan on business or you're in Japan for any purpose and you say a word wrong and mean something totally different, that's pretty bad, right? That's why you got to get them all right, okay? And I said, you'll thank this teacher later. And at the end of the year, of course, it was just this great moment. So the hardest teachers that you have are often the best if they demand a lot of you, yet they support you at the same time. So I hope that all of you have people in your life right now that are doing that. But these relationships that you have with the person that you were thinking of, if they're still alive, will be with you the rest of your life. And those people will help you in all that you do. So continue to establish important relationships, because I'm going to talk about that in terms of my own set of relationships. So ironically for me, when I did a postdoc at UNC Chapel Hill in the 80s, 2 things happened that were really important with my relationship with my postdoc advisor named Ken Harden. He was is a receptor pharmacologist. The first thing was, after I was there for 2 years, I started thinking about, do I want to stay in academia or do I want to think about going into industry? But I wasn't sure if I wanted to be in industry or not. And so one day he got a phone call from somebody from Burroughs Wellcome. And they said, we're looking for a basic scientist who could go into clinical research and started describing the characteristics of the job. And my postdoc advisor said, I have the exact person. She's standing right in front of me. You have to hire her. So that's how I got my job at Burroughs Wellcome, from my postdoc advisor. What I didn't realize is 6.5 years later, that same postdoc advisor and the project that I worked on back at UNC would form the basis of a company called Inspire, which I would ultimately become the CEO of. And so my postdoc advisor was the founder, one of 4 founders of the company that I ultimately joined after Burroughs Wellcome. But I want to go back to my work at Burroughs Wellcome for a minute. Russ mentioned the unicorn. And the horn of a unicorn was thought to have medicinal properties and magical powers. And being at Wellcome was very much like being at Camelot. It was a very special place. And for me, I learned that translating basic science into clinical research was really exciting. This drug Flolan, which probably nobody's heard of, but it was a product for the treatment of a very, very rare disease, orphan disease called primary pulmonary hypertension. And these affected mostly young women, but men as well. But when they were diagnosed with this disease back in the 80s, they would be dead within about 3 years. And they were usually in their 30s or 40s. And there were only about 400 new patients a year with this disease, and no one really understood it. But we had something that we thought would help it. And we went ahead and developed that drug, even though everyone told us there was no market. Of course, there's no market if there's only 400 patients a year diagnosed with this disease. But we saved all these lives. Well, I will tell you that today the primary pulmonary hypertension market is about a $5 billion market, and Flolan was the very first product, and there are many more products on the market now for this indication. Many times this happens where when diseases are not well understood, they're underdiagnosed. And so over time, people began to understand this disease and related diseases, and this was a very important drug. And that's what got me excited about working in the industry. So I had the good fortune of being not only recruited to Wellcome, but being given lots of opportunities. I had many people that helped me, and I was promoted just about every year, despite the fact that I sometimes was not difficult to work with, but it took me a long time to understand upper management. Of course, then I ultimately became upper management, but I would do silly things that weren't always accepted. But at Wellcome it was, because it was all about teaching you how to do a better job in the future. So in 1995, most of you probably won't remember this, but in 1995, Glaxo decided to acquire Burroughs Wellcome in what's known as a hostile takeover. Now, when your husband works for the company that is involved in the hostile takeover, it's a little difficult at home. So I'd be asking him questions, well, what's going on? You know, and are they going to fire all the Burroughs Wellcome people? And, you know, we have better people anyway, and we have all those good drugs, you know, we made. And so the Glaxo Wellcome merger happened in 1995, and he was on the Glaxo Wellcome integration team on people, and I was on the Glaxo Wellcome integration team for process, and we were flying all over the world and going in different directions. And at one point, I just thought, you know, I don't know that I want to be in the largest pharmaceutical company in the world. The culture sort of clashed a bit, and I had been recruited by Inspire, which was a company only on paper, around the same time. Actually, they were trying to recruit both me and my husband. And so the funny story there is that, you know, I told him, I said, look, I think I'm going to go do something entrepreneurial. And I said, you know, I think I don't want to be in the same company you're in. Well, why not? And I said, well, you know, you're more senior, and, you know, you're older, and you know, everybody knows who you are, and, you know, I'm kind of mid-management, and I don't want to be known as your husband. Well, he was very insulted by that. I didn't say that right. I didn't want to be known as Joel Schaefer's wife. I wanted to be known as Christy Shaffer, clinical scientist. And so he was very offended by this. And I said, well, you know, it's not that I don't want to, of course I want to be your wife, but I want to be recognized for my own skills. And I think if I stay, it's going to be very much about you and our relationship. So he thought that was just completely silly. So about a month later, as we were both going around the world doing integration work, he got on the elevator at the main building of the borough's Wellcome building, and in comes Trudy Elliott, the Nobel Prize winner from Wellcome, and a few other Wellcome people. And he's sitting there talking to them, and after a while they said, "Oh, you're Christy Schaefer's husband." And he came over and he goes, I get it. Yeah, okay, that felt kind of weird. So he stayed at Glaxo and went through the Glaxo Wellcome integration and then the GlaxoSmithKline integration. And I went off to be an entrepreneur. One night at home, he said to me, I was complaining about something, probably raising money or the frustration of being in a small company. And he said, when am I going to get to have fun? And I said, I'm not having fun. I'm, stressed out. I'm on the roller coaster ride, right? And he goes, you seem like you're having a lot more fun than I am. And so we had a really great opportunity when Inspire got started because Glaxo and Wellcome had just come together and all these great people were going to be available to potentially be in these small companies. I don't know if you know this, but there is a faculty member at Carolina named Marianne Feldman who has done research over the last decade on how many companies formed after either the Glaxo-Wellcome merger or the GlaxoSmithKline merger. Does anybody have any idea how many companies you think were formed? Monica, don't talk. You probably know. All right. How many of you would guess 20? Okay. 50. 50. 100. 124 companies. 124 companies. That's job creation, yeah? Because all these people had been trained and were ready and available. When these companies came together, two things happened. They offered severance packages that were very good, and people took them. They downsized in some cases, and then some people just said, I just want to go do something new. Some cases took technology out of the company, licensed it from the big company, and started their own company. And there are many examples of success stories that came out of those mergers. So mergers can create opportunities. When I got to Inspire, and I did not begin as a CEO, I was recruited to be head of clinical. And I thought I knew what that meant until my first week, and I learned that being head of clinical in a small company means you're head of clinical, regulatory, toxicology, emptying the trash, figuring out the computers, pretty much everything that wasn't basic research, discovery, I had to do. But I learned a lot, and we were able to raise about $13 million in venture money, which doesn't sound like a huge amount today, but I will tell you it was the largest amount of money raised by a North Carolina startup at that time in '95. And then I was able to be recruited as ultimately to become the CEO of the company a couple of years later, which is not something I wanted to do. I was the scientist and didn't feel like I had the capability of being a CEO, but they ultimately talked me into it. They came into a board meeting after a year of me being sort of the acting CEO or the COO, Chief Operating Officer, and we've been recruiting a CEO for about a year and hadn't found anybody that anyone was satisfied with. And they said, listen, we really want you to think about being the CEO. And they said, what's the big deal? Your title now is COO. And we just think if we just take that one O out, and we just drop an E in, okay? And we'll give you more money. And we've talked to your husband, and he thinks it's a great idea. So you see, the husband always factored in there in all these decisions. And so that was really great. I had the opportunity to, as Russ said, to build the company from really about, when I first started, about 20 employees, all the way up to over 250 in terms of moving it from R&D to commercialization and raising a lot of money along the way and meeting a lot of people and building a lot of relationships. Many of my old friends from Wellcome helped me a lot in terms of understanding what things I needed to do along that journey, which was great. But I can tell you that when you are trained as a scientist, you really don't have business skills. I mean, you do not learn those types of things unless things have changed. Those of you who are in science, are you learning business too? No? Okay. So I had to learn it by just being thrown in the deep end of a pool, which can work, but it's a little harder. And I had to learn to be very adaptable. That's one thing I would encourage you to do is just take a deep breath and walk in a door and take the opportunity if it excites you. It's all about passion, doing what you love. If you do that, you're going to be happy 9 times out of 10. So I wanted to show this picture for a couple of reasons. One is that these 4 scientists who were with me at the early days of Inspire in the very, very beginning, 3 of the 4 of them I'm working with now. One of them, I funded a company he helped co-found, which was technology from Georgia Tech and Emory, and they have an office in Raleigh. One of them is doing consulting for me and helps me do due diligence on projects. And another one is working for another small startup in North Carolina, and I'm doing some advising with them. So these relationships that you build are just with you all the time. So a couple of key things here. I've really mentioned this is that we started with about 20 employees, and about half were from Wellcome and half were Glaxo. So we had our own little integration. I think it was a lot easier with just 20 people. We only had one site. We didn't have sites all over the world, but we were able to grow it. Now, we really moved from spending a lot of money in the beginning in R&D to a lot of money in commercial and less in R&D, and that was hard. And I remember having to talk to the scientist about what it meant to build a sales force. So, anybody here been in sales? Okay. So, people said, well, we're going to have a sales force, and those people wear suits, and they get a car. Why do they get a car? Well, they have to drive around and see all these doctors. Okay, and they put about 200,000 miles in their car. I mean, it's ridiculous how much they have to drive around. And they just, well, you know, couldn't understand. The scientists had a hard time understanding it. So I put it in terms that I thought they could understand, and I said, you know, R&D and commercial, they're symbiotic relationships. If it wasn't for the commercial team making the money, you couldn't have the money to funnel back into R&D. Without you guys, they don't have anything to sell. So you got to work together. And that seemed to work with them. And we created a program where the scientists had the right to go out and ride with a sales rep and actually to be in the field with a rep selling, and or if somebody had to go on either maternity leave or disability leave, we'd put a scientist in the field. And believe me, they got to learn that it wasn't so glamorous having that car, right? It's a lot of windshield time and a lot of sitting around in a doctor's office waiting to be seen. It's not as glamorous as a lot of people think. We were lucky in that we had great investors from the beginning, and that really helped us a lot, and I learned a lot from those guys. And one of my best moments was in 2003, we got to ring the bell on NASDAQ in Times Square, and I will tell you, there's not really a bell, so that was disappointing. It's like they came around and they go, okay, we're ready to go. Christy, we need you to push that button. And I go, where's the bell? Well, that's just push that little buzzer. So it was a buzzer. The other thing is that they tell you to wave. Of course, they take this great photo, and the idea is that you think there's somebody outside looking in, watching you ring the bell, right? So you're on Times Square, and you know people are walking by, but I mean they're in New York. I mean they could care less what you're doing, right? So unless you're Mark Zuckerberg, nobody's looking at you. So you know you're waving, and the people are just walking past, you know. But it looks like you're really having an exciting time. It was an exciting time, I will say, to do that. So I now want to turn and talk about the roller coaster concept in that how many people, I know there's at least one or two, have started a company before? Couple, okay. For those of you that started a company, was the very first idea you had what you ultimately commercialized? Was it? No? Was it? No? Who was the other person? Was it? No. Okay. That's a pattern, right? That's 3-0. Okay. So same with Inspire. Okay. So you have to learn to evolve over time. The great idea that you had at the beginning may or may not work, or it may not work the way you think it's going to work. There may be something offshoot from that. So you have to be willing to be creative. And if you just get totally stuck and say, this is it, you may not ultimately be successful. The company Inspire, the name Inspire, was supposed to indicate we were going to be a pulmonary company. Okay, and we had an inhalation product for cystic fibrosis and some other pulmonary products. And the founders, who were pulmonologists, they named the company, and so, that's what it meant. Well, the scientists figured out, you know what? These same receptors that are in the lung are in the eye. Okay, and God put them there for some reason. Let's figure it out. So they did, and they said, there's all these ophthalmology opportunities. So I went to the board, and I said, we should think about doing some of these dry eye projects and other ophthalmology projects. And they said, oh, we can't do that. We can't get diverted, can't get defocused. And the name Inspire is to denote pulmonary. And we had a logo that was like a blue ball, and it had these little waves going through it, and that was to denote these cilia that beat in your lung to propel mucus out, right? So no one really knew what that was, but the founders, and they said, oh, that's the ciliated epithelium, that's the logo. And so I said, listen, Inspire has two meanings, okay? And those little waves, they can be eyelashes, okay? So look, we got to be flexible, okay? We got to be flexible. And what happened was it enabled us to get two really important partnerships. One with the global ophthalmology leader, Allergan, and the second with a Japanese ophthalmic company, which is the best one, and it's actually the oldest ophthalmology company in the world, Santen. Okay? And so that brought in a lot of money, it brought a lot of focus in some other areas, and turned out to be really instrumental. I just want to stop for a minute and say about Santen is, ironically, so we worked with Santen from the beginning to the end. They ended up launching a dry product, our product, in Japan. And circling back now with Santen, Hatteras just invested in a company last year called Clearside Biomedical, and we just got our first corporate partnership and raised almost $8 million. And guess who that company is? Santen. So back again to that relationship. But because of that one strategic move and that one board meeting where it was very difficult to get them to see we needed to do this, we actually ended up having 4 different products that got launched and we sold as a company. And some of them we co-promoted, like Restasis, which you might have seen on TV for dry. We got a lot of royalties on Restasis. Has anybody ever seen the ads on Restasis? Okay, women, I know you've seen them because they're on all the women channel. Women get a lot of dry after menopause. But this is a great story in that Allergan was developing this drug Restasis. And we were developing our own product, and they were going to potentially compete. So we got very worried about that. And we said, well, the only way that we'll work with you is if somehow we have some sort of sharing on this. So they allowed us to co-promote it. And we got to put our reps on it. We got to learn under Allergan. And we got these royalties, okay? And I had this anybody here an attorney? There's at least one attorney in the room. Okay. Well, I had this great corporate attorney who said, I'm gonna work on this agreement. And they were very worried. They didn't think Restasis would get approved. And so it was in development, ours was in development, and that's why they wanted to work with us. They thought it wouldn't get approved. So she said, in the chance that yours doesn't get approved, but theirs does, I'm going to have all these rights survive. Just remember that. You want rights to survive, okay? And I said, oh, that won't get approved. Don't worry about it. She goes, oh, well, just let me work on this, and you'll thank me later. Well, the royalties Inspire got over the years on Restasis, which they thought would not get approved, which did get approved, $280 million. Okay, so other message, get a good attorney. Okay? Listen to attorneys. So, of course, ultimately the company was bought by Merck, and so the year before that I had retired from Inspire and started doing a lot of work on innovation. I was doing a lot of work in nonprofits. I was doing a lot of work on UNC campus to try to build more companies. And one thing I've figured out, we have a huge problem in that there is a funding gap. All these great ideas at all these colleges and universities, but there's no money here in North Carolina to help fund them, or very little money. And so that's why I thought, joining Hatteras would be exciting. So I've really kind of come around full circle from starting as a young scientist in academia to going to industry to going into the venture capital area. And it's been a lot of fun because I've been able to work in an environment where I can take all the skills that I've accumulated over the last 25 years and put them all to work. So I help small young companies grow. And I'm talking about companies that have anywhere between 3 to 10 people, and just getting their very first amount of money. And so that's what's exciting about it. So what we do, Hatteras Discovery, which is what I manage, is we look for technologies not only out of universities, but largely out of universities, and we try to get that science through the funnel into humans. So take the good idea, do the toxicology studies, do the necessary work to go to what's called the investigational new drug application with the FDA and get into humans, and then if it's successful, we continue to fund that or we find other ways to fund it. So we've only got 2 right now. Actually, we have 3, 2 of which are in North Carolina. And it's still an experiment. But the idea is to really work closely with academic scientists to allow things to go a lot faster than they normally would at an academic pace. And we've been able to do that now twice. So one of the things that I realized I needed to do first of all, how big you think my group is, Hatteras Discovery? Don't say Monica. I know you know. 25. Who else thinks this? Give me a number. How many people you think I have in my group? 5. 3? How many? 7. 2. So me, and I have a Hatteras Discovery Fellow who's awesome, Manish Agrawal, who just graduated from Keenan Flagler as an MBA student. He's going to join GSK in the summer as a full-time job, but for 6 months he's working with me for free, by the way, for the experience. I use a lot of consultants, but we're very virtual, okay? So I knew that I needed some other heavy lifting to happen. So we put together what's called our Portfolio Review Committee. It's chaired by the current global head of R&D for all of GSK. GSK is an investor of the Hatteras Fund. The co-founder of Genentech, I'm sure you guys know Genentech is a company, Herb Boyer, who's amazing. What they do is I bring company ideas forward to them, and they review them, and then once we select the companies, we bring them back before the PRC to have them give them ideas and really critically evaluate the key things they need to be doing in the future. And that has worked exceptionally well, exceptionally well. Now we see a lot of opportunities. So in addition to being on boards of companies, every day I'm looking at companies. I'm looking for ideas. So we see as a firm about 300 opportunities a year. About half of those are in what we call the early stage space or prior to the clinic, which are really what I'm looking at. And on a given year, we're only going to do 3 or 4 of those. So we have to look at a lot of things to find a couple of good ones. This is sort of the map of where we have sort of active deal flow. You can see a lot in North Carolina. Some of our funding comes from the North Carolina Innovation Fund and the North Carolina Rural Center. And so we want to have as many things as we can in North Carolina. These are all of our many relationships, which you can see there are a lot of them. Again, back to the importance of relationships. By having all of these relationships, it allows the firm, Hatteras, to connect our little startup companies to all these players that could either acquire the company down the road or partner with the company down the road. We have another strategic investor is LabCorp. You all know LabCorp down the road in Burlington, a very successful North Carolina company. And the former chief medical officer of LabCorp, Mila Goldman, is also one of our venture partners and is CEO of a little company we spun out of UNC called GeneCentric for lung cancer. So in terms of lessons learned, for me it all started with the science, the relationships that were really important, but you have to be passionate. I can tell you that if you wake up every morning and don't want to go to your job, it's pretty bad. Has anybody in here ever had a job that they just really didn't like? Okay. That you didn't like. Okay. Has anybody had a job they really love? What does it feel like when you get up in the morning and you really love to go? Yeah? Exciting, you're just raring to go. And so if you can do that, you guys cold over there? My hands are freezing. They got a blanket going on over there. Wow. All right. So I want to talk a little bit about some of the softer things that Russ mentioned. To me, I learned a lot at Burroughs Wellcome that people matter. Everything you do, if you don't have good people, it's not going to work. And so we try to do a lot for people's families. We had, Family Day. I stole that idea from Burroughs Wellcome. We had all those cool things. We had a cycling team. This story was that this person over here in the second row with the sunglasses on, Todd, he was our IT guy. And one night he emailed me about 9 o'clock and said, I wonder if you would sponsor me for the MS 500 we're riding, and I'm going to be wearing a Glaxo jersey. I'm on the Glaxo team. And I sent an email back. I said, Todd, whoa, why are you wearing a Glaxo jersey? And why don't we have a team? And he said, well, would you support a team? I said, absolutely. So that was our team. They rode for cystic fibrosis, MS, and just about anything they could find, they did. And to go back to that, to say that 3 of those women on the cycling team are now part of Clearside Biomedical that Hatter is funded. So again, I just keep bumping back into people I knew. Russ mentioned a couple of the awards that we won. And I was really proud of that because I wanted to create a place where you wanted to come to work every day. And I'm now going to switch gears a little bit and just tell you why I'm excited about what you all are doing here and the idea about job creation and innovation. I've done a lot of work in this area. Let's see if I can get this right. Okay. So this is a quote from the National Science Foundation about empowering the nation, and that we are now at a point in time where problems are really complicated. They're really complex, and we need smart people. We need people like you learning to integrate a lot of complicated things where there's a dovetailing of engineering and medicine and liberal arts and sciences coming together cross-disciplinary and across matrices to solve the world's biggest problems. And you can be, I think, a part of that. This is obviously Steve Jobs. There is a lot of intersection between the arts and technology now. And universities are increasingly important because this is where a lot of great ideas come from. This is why I've gone to Congress now 3 times to lobby for the NIH. Okay? Because the NIH is so critical in funding biomedical research and making sure that these great early ideas get fostered. And so, we're lucky to be here in North Carolina where there's a lot of innovation. I mean, think about 30 years ago, we were driven by the tobacco industry and textiles, and we've shifted to the knowledge-based economy and biotech. People heard a story about retraining, how great that was to see that happen. So it's a really good time. It's a really good time to be in the area of science. It's a really good time to be in the area of innovation. Don't give up because, look, we are now, sadly, about the 14th country in the world in terms of science education. 14th. Think about who's ahead of you if you're 14th. We don't want to be 14th in basketball, right? I mean, that'd be really bad, right? So we have to do something, right? I mean, we have to do something. And we need people like you, young people, to get excited about science and about innovation and not be afraid to go into these hard fields that we can truly innovate. Because I think that's where we have an advantage over other countries. We're pioneers. We like to use our ingenuity, and we need it for the world. We need it to solve lots of the world problems, whether that's sustainability or biotechnology. And so the good news for you guys, I think, is there's lots of possible jobs if you get trained well. There's all kind of government jobs, there's all kind of biotech jobs, there's jobs all over the world in addition to the United States. And so there's all kinds of opportunities that you can work on. It isn't just one thing, there's many. So I hope that you feel that you do have those opportunities, because I think they're there. So I'm going to end by just saying that I've had a great roller coaster ride. There were many times that were exhilarating, and then there were times when I felt like I was going to fall out and a little white-knuckled. But it's always been worth it. And for me, giving back to the community is also a big part of what I try to do, because I've been given so many opportunities myself. And so I hope that you all each enjoy your own journey. And thank you for the invitation to Foresight Tech here today. And please ask me a lot of questions, either now or afterwards. Okay.